Hi, my name is Anayeli Hernandez. I am in Ms. Jenny's CNA class. Today, I'm going to be talking about infection control regarding VRE, or the technical name being vancomycin-resistant enterococci. It's an infection that has bacteria resistant to antibiotics, especially the vancomycin antibiotic. Usually doesn't make you feel sick, but it can cause infection to the bloodstream, urinary tract, brain, and heart valves. It usually lives in the intestine and the female genital tract. Signs and symptoms for VRE include fever, genital sick feeling, fast heart rate, chills, redness, swelling, or pain in your body. The port of entry for VRE include urinary tract, gastrointestinal tract wounds, or the by using intravascular catheters. Um, it is VRE is a bacterial infection that has to go inside your body. It is not airborne, so you would have to touch it physically in order to be able to receive it, to get it, to get it. Um, physical, Psychological needs for a patient with VRE, they might suffer emotional stress because they are at risk of infecting other people. Kind of like COVID right now, except it isn't airborne, like I said before. They may have to be isolated from others, and healthcare workers will have to use personal protection equipment around them, which can make them feel out of place and very alone for the period of time that they'll be isolated. Susceptible hosts include patients that have previously been treated with antibiotics for a long period of time, especially if they were treated with vancomycin, which is one very known antibiotics. Patients who are hospitalized after going through a surgical procedure are at high risk because the immune system is trying to work to get them better, and VRE is something that goes around in hospitals a lot. Um, Another person that is at high risk of getting it is if they have a medical device inside their body, such as catheters, um, because something like that would have to go in, and that's the only way that VRE could go into your body, not by your ears, eyes, or nose. It would have to be directly in through, like I said, a wound or your mouth, or any other um, ways of entry. Modes of transportation: VRE is spread through direct contact with the contaminated surface, equipment, or through person to person contact that spreads most commonly by hands and bodily fluid. It is not airborne, so you cannot get it by just breathing around somebody that has it, but you can get it if you touch them, or if you touch something that they previously touched and it wasn't cleaned after they touched it. Portal of exit, it is transmitted through feces of a patient. So who a patient that has VRE would have would only be able to transmit it through feces or bodily fluids, actually. It can't be um it can't really be transmitted through a cough or a sneeze. Um, Ways to prevent transmission of this would be: wash your hands often, frequently clean areas that may be contaminated, uh, wearing proper PPE like gloves if they may come in contact with bodily fluids, or if they come in contact with somebody that has VRE. And then, if you do have VRE, always inform a healthcare worker if you or anybody around you has it, to be able to take the proper measures to keep it from spreading. Thank you.